This medication, Penicillin G Procaine Syringe, is used to treat a wide range of bacterial infections. It is a long-acting natural penicillin antibiotic that works by stopping the growth of bacteria. It should not be used to treat gonorrhea. The dosage and frequency of this medication will depend on the severity of the infection and your body weight. It is important to take this medication as directed by your doctor. The best time to take this medication is usually on an empty stomach at least 1 hour before or 2 hours after a meal. Be sure to follow your doctor's instructions carefully for the best results. This medication is administered through an injection into a large muscle, as instructed by your doctor. The dosage is determined based on your medical condition and how you respond to the treatment. For children, the dosage may also be determined by their weight. If you are administering this medication to yourself at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using, make sure to visually inspect the product for any particles or discoloration. If you see either of these, do not use the liquid. It's important to learn how to safely store and dispose of medical supplies. To get the best results, it's important to follow your doctor's instructions on when to receive this antibiotic, and make sure not to miss any doses. Continue to take this medication until you have finished the full prescribed amount, even if your symptoms go away after a few days. Stopping the medication too early could result in the infection coming back. If your condition persists or worsens, make sure to inform your doctor. If you experience pain at the injection site that lasts or gets worse, tell your doctor or pharmacist promptly. This medication has been prescribed because the benefit to you is greater than the risk of side effects for many people. Tell your doctor right away if you experience any serious side effects, including joint/muscle pain, severe pain/peeling skin at the injection site, numbness/tingling of arms/legs, pain/redness/swelling of arms or legs, change in skin color near injection site or on arms/legs, uncontrolled movements, inability to move, signs of kidney problems, new signs of infection, easy bruising/bleeding, dark/cloudy urine, seizures, mental/mood changes. Get medical help right away if you experience any serious side effects, including chest pain, trouble speaking, vision changes, or fainting. Stop using this medication and seek medical help immediately if you develop any symptoms of methemoglobinemia, including headache, confusion, dizziness, shortness of breath, tiredness, pale/bluish/gray skin, or a fast heartbeat. Notify your doctor right away if you experience symptoms of Yarish-Herxheimer reaction if you are being treated for syphilis. This medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile, so tell your doctor immediately if you develop persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. Get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you experience any other effects not listed, contact your doctor or pharmacist. Before using this medication, make sure to inform your doctor or pharmacist about any allergies you may have to penicillin, cephalosporin antibiotics, or procaine. It's also important to discuss your medical history, especially if you have kidney disease, breathing problems, heart disease, or certain blood disorders. It's crucial to note that this medication may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using this medication before receiving any immunizations or vaccinations. Additionally, older adults and newborn/infants may be at a greater risk for experiencing side effects while using this drug. If you are pregnant, this medication should only be used when clearly needed, so be sure to discuss the risks and benefits with your doctor. And finally, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of any drug interactions that can affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Penicillin G Procaine Syringe include blood thinners, such as warfarin, methotrexate, NSAIDs, such as aspirin, indomethacin, tetracyclines. If you have been prescribed low-dose aspirin for specific medical reasons such as heart attack or stroke prevention, make sure to continue taking it as prescribed by your doctor. It's important to ask your doctor or pharmacist for more details. It's also important to note that this medication may interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much penicillin G procaine and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. Symptoms of overdose may include seizures, confusion, and changes in mental or emotional state, such as agitation. It is important for residents in the U.S. to call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Remember, it's important not to share this medication with others. Your doctor may also want to schedule lab tests to monitor your kidney function and blood count while you're using Penicillin G Procaine Syringe. Be sure to keep all of your medical and lab appointments. If you have any questions, consult your doctor for more details. Be sure to take each dose of this medication as directed. If you happen to miss a dose, consult your doctor or pharmacist to determine the best course of action. Do not take a double dose to make up for the missed dose. When storing Penicillin G Procaine Syringe, make sure to keep it in the refrigerator between 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius. Avoid freezing it and always keep it out of reach of children and pets. Never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. When the product is expired or no longer needed, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.